Joint preservation techniques for optimal mobility. Arthroscopic debridement. Removes damaged tissue and debris from the joint. Cartilage repair. Techniques like microfracture stimulate new cartilage growth. Osteotomy. Surgical realignment of bones to relieve pressure on damaged areas. PRP therapy. Platelet-rich plasma injections promote tissue healing and repair. Stem cell therapy. Uses stem cells to regenerate and repair damaged joint tissues. Synovectomy. Removal of inflamed synovial tissue to reduce pain and swelling. Meniscus repair. Surgical repair of torn meniscus to preserve knee function. Cartilage osteochondral grafting, OATS. Transfers healthy cartilage and bone to damaged areas, restoring joint function. Cartilage autologous chondrocyte implantation, ACI. Harvests and implants healthy cartilage cells to promote new tissue growth. Arthroscopic ligament reconstructions. Minimally invasive surgery to repair torn ligaments, restoring joint stability. Arthroscopic tendon repair, e.g., rotator cuff. Repairs damaged tendons with small incisions, restoring joint strength and mobility.